is also fluoride. It's a sodium fluoride. It stays on the teeth until you brush it off. So you want to instruct the patient that they can eat and drink afterwards. They just want to avoid hot liquids like coffee or soup, and crunchy things like peanut brittle, taco, things like that. But other than that, they can eat. You don't want them to brush it off till that night when they go to bed. It sticks on the teeth, so it's going to make their teeth feel rough. They're not going to have that nice smooth feeling that they get when they usually leave. But this works very, very good for sensitivity, and because it stays on so long, it gets into the gingival curricular fluid and has a substantivity, which means it lasts for hours. Okay. It's great for kids because they can eat and drink right afterwards. You don't have to worry about them swallowing it and then getting sick, which is one of the main problems with the foam. And it doesn't take 4 minutes to do. So it's really nice. So first thing, you want to make sure you explain all that to them. You want to dry the teeth as much as possible. They don't have to be super, super dry. Just a little bit. You're going to open your package. You're going to put it on the back of your glove. Okay. Now this stuff is very sticky. Okay, if you get it on their lips or something like that, it's very sticky. You're going to mix it up with the applicator brush that they gave you. Okay. Open big for me. Just real quickly dry them again. And you're just going to paint it on, kind of like fingernail polish. You can do a few teeth at a time, then wipe it off. If the brush gets wet, it tends to glop up, so you don't really want that to happen.
Okay. Go ahead and rinse her out then, and then sit her up, and I'm going to get her away.
Now the comb says to put it on all surfaces of the teeth. Each brand of fluoride is a little bit different. This particular brand, you only have to put it on the facials, and it spreads everywhere else. Okay?
Oh, on the top, and we just state that we should place that.
Yeah, on all the surfaces, yeah.
Then we just don't go.
Right, because if we ever get a different brand, you know, sometimes we get different brands of things. I've got gauze on it because I haven't dried it off.
So we just state that.
Yeah, we state that. Just put it on the facial.
No, you're going to state that you put it everywhere, but that you're, this particular, you know, so say that on the comb. And just brush it on. Don't go, you know, do each tooth individually. Don't be like, you know. Or I've seen this past weekend, one of my ETA students, she did it with, and you can give them some water afterwards. I mean, it doesn't, they can swallow it and everything, no big deal. There you go. And that's that. Set them up.